All right, it's 8 o'clock. Let's call the Finance Committee meeting to order. All members are present. I'd entertain a motion to adopt the agenda as published and also approve the minutes from March 18th. Moved by Doak. Second by Steve. Any discussion? All in favor, signify by saying aye. Aye. Opposed, hearing none, motion carried. Anyone here for public comment? Apparently we have no one for public comment, so let's move on to item 6, the monthly administrative reports. Paul, you want to do the financials, the med, dental, and the overtime?
Sure. We'll keep this short this time because we have more to cover down number 11. So sales tax collected this month, the first the first payment that's gonna come as revenue in the year, 119,883. Comparison to last year, it was 110, so up a little bit, but it's only one of the 12 months. And last year we saw how that varied all over the place. Financial reports are through February, so of course there's not a whole lot happening, nothing to report there. Again, number 11, wrapping up for 2024 is a bigger deal. We'll spend some time on that. Dental and medical reports were in the packet unless there's any questions. Again, it's early in the year. You do see some swings in that, especially early in the year. I think both of those are up, but it's only 2 months into the year. I'm not sure that means a whole lot yet. And unless there's questions on that or overtime, I don't have anything else right now.
Anyone have any questions for Paul? If not, we'll move on to item 7, the health insurance plan performances and review, and our friends from Horton are here. Welcome.
Thank you. Morning.
So I guess you have the floor.
So I can just briefly introduce Dan Hogan is our
Do you have your microphone on? I can't hear you back there. Sorry.
Yo, good call.
It's tough in the peanut gallery.
Thank you for that. My apologies. Dan Mongovan, our lead contact with Horton, who brokers our plan and helps us administer it, is here. He prepared some materials, and Dan and I had a couple conversations just so that he could be as well informed as I could help him to be on questions from the committee this morning. But we will basically turn it over to Dan to kind of present some information, and I'm sure that he would be available and interested in any questions that the board has after that.
Absolutely. Thank you. All right. I got this on. Good morning. Just put together a couple pieces of information for the committee here. A little bit of a look back at kind of how things have been dating back to sort of 2019, and then even doing a little bit of a prospectus moving forward from sort of a financial analysis perspective. And then, yes, absolutely open to sort of any dialogue or questions that anybody may have. I'm just turning to sort of page 1 with some talking points here. You know, we've made a transition to Centivo. The county had been with Humana for many years, I think a decade plus, and Humana effectively kind of went out of business and stopped offering. I shouldn't say they went out of business. They got out of the employer-sponsored medical business back in 2022, and at that time, the county's hand was effectively forced to make a change. And so we did some analysis, and we went out to the marketplace and looked at several different options, and ultimately landed with an administrator named Centivo in 2023. And the good news is that financially, this has really, as I noted, sort of put the county back in the driver's seat. We've had some of our best renewals and our best rates and the best plan designs that we've had in years. Centivo's model is a little bit different. It's a little bit progressive as compared to the traditional insurance model. They've got a very primary care focused medical plan model. It's a value-based network where they're trying to sort of steer and direct the membership and the county employees to some of the lower cost, higher quality providers in the area. For county members and employees and family members whom that doesn't work for, we still allow this sort of traditional medical plan that was always in place with Humana. By making this transition to Centivo, it's allowed us to kind of a la carte our benefit plan, buy our own stop loss insurance, source our own pharmacy benefit manager. And those were a couple of things that we weren't allowed to do when we were with Humana. And in being able to sort of parse those pieces of the self-funded pie out, we've saved substantial money, which I'll talk about in just a moment. But it hasn't been without some stress and strain on the workforce. This change to Centivo has certainly come with some bumps in the road. Now, if we would have left Humana and went to United Healthcare or went to Anthem or went to Wisconsin Counties Association Group Health Trust, would there have been some consternation and some employee noise? Yes, probably so. Has Centivo maybe caused more noise than would exist with one of those other vendors? Little hard to say, but it is true that we have had some billing issues and some claim issues and some customer service issues with Centivo that both Horton and the county have worked tirelessly over the last, call it 24 months to help sort of smooth out some of these bumps. Many of the bumps have smoothed out, but there continues to be some noise here and there with this newer program. Okay. Any questions on that? All right. I'm going to have you turn the page. So from a financial perspective, I've got this page up here with this per employee per year spend analysis. Per employee per year, PEPY, is a metric commonly used in health insurance to compare year-over-year data. Of course, the employment counts and the head count here at the county fluctuates. So we can't just look at total spend in 2019 versus total spend in 2024, because you may have had 130 folks on the plan in 19 and 120 people on the plan in 2024. So we break it down and sort of normalize it by a per employee per year basis. And I've got sort of three metrics on this page that are noteworthy. That top line is going to be net claims. So that's the combined medical and pharmacy claims on a per employee per year basis. If you look at 2019 with Humana, you'll see that $17,000 number. The middle column is a stop loss premium. That's the insurance that we purchase to protect the county from shock loss claims and from many aggregate claims. And so that's a fixed cost of $6,700 back in 2019. And then we combined all of our fixed costs together for a PEPY on that bottom row of $7,158 in 2019. You can kind of work your eyes across the page from left to right and see that in 2019 to 2020, the cost jump again in 2021. We had a tough 2021. They get a little bit better in 2022, and then we make the transition to Centivo in 2023 and 2024, and we really start to see a meaningful drop off in these expenses. I think the takeaway for me on this page is if you look at 2024 with Centivo, almost all three columns in 2024 are less than or equal to what we were paying back in 2019. And you read the paper, you see what's in the news, you all are well aware of probably what's going on with healthcare and your own expenses for your own family, and it's not going down. The medical trend and inflation that's taking place in the medical and pharmacy environment is upwards of, depending on what you read and who you talk to, call it 6 to 10% a year, up and up and up and up. Unsustainable for sure. So it's refreshing and unusual to see that what we're spending today at the county is at or less than what we were spending 6 years ago in 2019. And I think that that's a positive trend that I would attribute to both our transition to Centivo and our move away from Humana and our ability to better shop for healthcare and to better shop for insurance, stop loss insurance and pharmacy benefit management. And I think that's got to also be attributed to the workforce here, whom either I don't think the demographics have changed terribly much, but people come and go and there's some turnover, and maybe we've benefited from a bit of a healthier workforce over the years as well. So I think all those things together have allowed us to put on paper a pretty positive story over the last handful of years. Questions on that? Okay. Next page is meant to sort of bring some dollars, some real dollars to this discussion. This is an analysis of, had we stayed with Humana over the last few years, which again wasn't a choice, we had to move, but I think this paints Centivo in a fairly positive light. In 2022, with Humana, for our entire sort of medical budget for the county, we spent about $3 million. If I trend that forward at a 6% increase every year, which is a pretty modest trend and modest increase through 2023 and 2024, we would have spent about 3.2 million in 23 and about 3.4 million in 2024. On the right is what we actually spent with Centivo, all in: medical, pharmacy, fixed expenses, administrative expenses. So our actual 2023 spend with Centivo of 2.664 and in 2024 of 2.715, combined those 2 years, it's about a $1.2 million differential. Do I call it a savings? I don't know if we necessarily call it a savings, but a sort of better situation than we probably would have been in had we either stayed with Humana or been forced to stay with Humana. If I extrapolate that out to 2025, which we're a couple months into 2025 here, we would have been probably projected to spend about $3.6 million with Humana. With Centivo, our projection for 2025 is 2.878. That's a $722,000 differential. So there's meaningful dollars here, I think is probably the takeaway. And the transition to Centivo, the ability to be better consumers of healthcare on the sort of consumer employee side, and on the employer and self-funded administration side, to be able to shop and secure a great vendor at some better price points, has been a very positive experience for the county. The next page I won't belabor. It just extrapolates these numbers out a few more years to 2028. This is getting to be a little bit speculative. But if we assume a 6% increase with Centivo, just like we would a 6% increase with Humana, the dollars just sort of continue to add up. And the differential between being with a bit of a rigid Humana, who sort of forced us to have all of our vendor relationships under their umbrella, Humana Stop Loss, Humana Pharmacy, Humana Medical Administration, versus Centivo Medical Administration, and then pick and choose your own stop loss carrier, which we shop for you each and every year. Pick and choose your pharmacy benefit manager, which we look at every few years. I think there's just been a positive story. Okay, so I won't belabor that anymore. Any questions on that piece? Okay, moving on. What else could we be doing? Is Centivo the only show in town? What are other counties and public entities doing out in the marketplace? I want to just touch on that for a little bit, and maybe this will spurn some dialogue as well. I think the last time I was up here, there was some discussion around spousal carve-outs, spousal surcharges. For those unfamiliar, it's sort of a risk management technique that employers of all shapes and sizes consider, and it's meant to mitigate risk for the health plan. It's specifically targeting working spouses, okay? And the rationale or the logic is, should the employer, in this case the county, is it our responsibility to insure some other employer's employee? Okay, so said another way, if you work here for the county and you insure your entire family through the county, wonderful. If your spouse, though, happens to work somewhere else full-time, they're gainfully employed at some other employer, and they are offered insurance through that employer, should we allow them to still be on the county's plan? And so there are, more so in the private sector, there are instances where you can either charge, we call them working spouses. You can charge working spouses more to be on the county's plan. An even more sort of dramatic lever that on occasion gets pulled is you could disallow working spouses from being on the county's plan. And I mean that in the way that it came off, right? You wouldn't allow a Kewaunee County employee's working spouse to enroll in this medical plan. And so from a risk management perspective, you might think like, that makes a lot of sense. Like, we'd like to cover less bodies. We'd like to have less risk. We'd like to pay less dollars towards people's medical and pharmacy expenses. And there's some truth to that. The question that I also often bring up is, are you really saving anything though? Because we're self-funded. And so just by having bodies on our plan, there's actually some benefit to that. It sort of helps the premium pie. It sort of helps the loss ratio discussion. And just because people are on the plan doesn't mean they're actually costing the plan meaningful dollars. If you've got a spouse that's on the plan and they don't have a lot of medical or prescription drug expenses, then they're actually probably helping subsidize the rest of the plan, right? That's insurance, kind of law of large numbers discussions. And then, of course, there's the human resource and human capital management side of that discussion. I'm sure there are some folks that work here and that work at all of my employers who for whom benefits is a really important part of their total compensation package. It's an important part of the reason that they work for that employer. And if you start to infringe on that benefit, it isn't always well received by the workforce, right? And so I'm always up here talking about the sort of the financial management of a benefit plan, and then the need and ability of employers to attract and retain talented people. So what the county does have in place to address this is what I would call a little bit of a softer approach, and it's called the Family Savings Plan, which some folks here at the county do take advantage of. This is a benefit that helps working spouses or families that have access to other employer-sponsored health care. It gives them a bit of a white glove, soft landing to escort them off of the county's plan and onto that spouse's employer's plan. And it helps them financially make that transition, and it even covers some of their out-of-pocket expenses to make that transition. It's not mandatory, it is not forced, but it is communicated every open enrollment that, hey, Kewaunee County employee, if you've got access to other employer-sponsored coverage, we've got a solution in place that would help you jump onto that other employer's coverage. We'll cover the premium differentials that might exist. We'll cover your out-of-pocket expenses. And this is a very nice risk management technique for the county that I think is better received by the workforce and protects the county from insuring folks that it otherwise might not need to insure. That's a lot about spousal carve-outs and spousal surcharges. Any questions or comments on that? Yes, sir.
So last year, I believe it was last year before last year, we discussed the spousal carve-outs. And I think we were going to go back to the staff and ask them what their input was in some way, shape, or form. Did that ever happen? Did we get feedback from anybody that, hey, that's a great thing we'd like to get into, or where are we at with that?
Thank you, Supervisor. So I remember the question and discussion coming up, and I think my intention was to bring Dan back today to talk about so you have a broader perspective on what the marketplace is doing and how other employers are addressing that, as well as our own. I didn't make any specific analysis on whether we ought to or ought not, but I think what Dan just talked about is the factors to consider in those decisions. And also, I think one thing I believe to be true is that if the working spouse's employer doesn't offer coverage, Then Dan, can you talk about how that would be handled in a spousal carve out if the other employer doesn't offer a plan?
Yes. So I was just looking at some data. I mean, another one of the questions that comes up in these discussions is like, who are we even talking about? That might sort of be your question. Most recently, we have 36 employees that take single individual coverage, and we have 76 employees that take family coverage. Okay, so we're not even talking about the 36 singles, the 76 families. Of those 76 families, we'd need to try and figure out how many are bringing a spouse onto the plan, this plan, because some of those families might just be an employee and children and not include a spouse. But how many are bringing a spouse on the plan? And then of that population, how many of those spouses are gainfully employed elsewhere? Because what we're not talking about is any and every spouse. If there's a spouse that stays at home, that works part-time, that even works full-time but does not have access to employer-sponsored coverage through his or her employer, that they're not in this discussion. It's from a compliance and legal perspective, there's rules around treating those folks differently. You need to have access to employer-sponsored coverage. And so typically my assumption is if we were to survey the population, probably go over like a lead balloon. Most folks, that doesn't excite them, this idea of a spousal carve out and disallowing your spouse from being on the employer's plan, right? It's more of a sort of an employer mandate than an employee request. I'll also say, just for context perspective, I should have mentioned this. My experience in the public sector, schools, counties, municipalities, and cities, the spousal carve out and spousal surcharge concept, not real popular. More popular in private enterprise. Why? In my opinion, it's twofold. I think in the public sector, historically, right or wrong, there's been a bit of an expectation that the benefit package is a big driving factor of why folks work in the public sector, be it at the county level or at a public school level. And again, sort of like diminishing those benefits or changing those benefits across my book of business, while we talk about it almost every year, you start to add the human element to it, and they have a harder time sort of pulling the trigger on that type of benefit change, where we're going to charge working spouses more to be on our health plan or disallow working spouses from being on our health plan. Private entity, a little less of consternation there, if you will.
And I agree. I mean, I don't think any of us here are looking at anything of cutting anything back.
Right.
But obviously, you know, when we're looking at between Humana and Centivo being the two that were presented, and presumably there aren't any other companies more competitive out there, from what I'm understanding.
Right.
So Centivo is what we would be best to stick with.
Yeah, you know, at this point, I think Centivo's been a work in progress. I think financially, it's clearly been a win. We're continuing to work through some of the employee relations and employee related matters. A couple of my next talking points will be around some alternatives to Centivo that you know could certainly be looked at year in and year out, whether it's going back to being fully insured or looking at Wisconsin Counties Association or looking at some competitors of Centivo like United Healthcare, like Anthem, like WPS, some names that are maybe a little more familiar to those in the room. Those options will remain out there and will remain, I would say, under review. I'm not here today to suggest that we must stay with Centivo, and my recommendation is to stay with Centivo for 2026 and beyond. They're just a piece of the puzzle, and they could be substituted out for somebody else with relative ease. Centivo does offer some tools and some cost-saving mechanisms that others don't. So that would certainly be a factor in that analysis. Any other questions on the spousal piece? Okay. My next, are we okay? Good. My next couple of comments were around, other options to consider. And again, Centivo, we're in our third year with Centivo, and they've been a fine partner, not perfect, but fine. And we're continuing to work through that. There are other ways to fund and manage a health plan for a group like yourself, a county like yourself. Wisconsin Counties Association, right? They've got it in their name. A very common and prominent player in the insured marketplace for not just counties. They've also broken into the public school space too. They do a really nice job. They've got sort of United Healthcare as their back office. Some of my comments here are they'd be a safe choice. They're very familiar and traditional and well known and reputable. They've got a history of pretty stable pricing and stable renewals. It is a pooled product though, so I make the comment here that you never really get the renewal that you deserve. If you're having a really, really tough year, you're going to get a better renewal than you deserve because the counties association has this pooled product, and they've got lots and lots of public entity employers that are on their books throughout the state of Wisconsin. And they know that public entities sensitive to large fluctuations in budgets, and to deliver a 30% renewal to a 130 life county would be devastating. So if we have a really bad loss ratio with the WCA, you get a better renewal than you deserve. But the flip side's true too. If we have a really good year and we have a really positive loss ratio with WCA, you don't get as good of a renewal as you deserve. That's again sort of the insurance mechanism at work. There's subsidizers and subsidizees, and WCA does a nice job of trying to stabilize that. Now, the county hasn't been fully insured in decades, so I think for the most part, these numbers I shared with you and the projections that we have, to me as your consultant, sort of professionally suggest that we sort of stay the course in this self-funded environment, but that's always going to be up for debate and up for review. If we are to stay self-funded like you've been for decades, as I mentioned earlier, Centivo is one choice, but there's others out there as well. UMR, United Healthcare, Anthem, WPS, those are again some of the more traditional and well-known names in the marketplace. I think that familiarity and the size of those entities I do believe that it would relieve some of the employee stresses and some of the employee issues that we're having. But I also believe it will cost more money. It's just how those bigger players operate. And so, what do you know? We're back to the discussion around sort of finance and human capital management. And we're always trying to balance that as best we can, knowing that the county certainly has a budget and certainly has work to do and needs all of its wonderful employees to stay here, remain here, and enjoy their time here. And so working to balance that out is sort of a constant challenge in our role. Lastly, I just grabbed a few benchmarks, kind of real-time benchmarks from some other public employers that we've got on our books, just because I think it's on occasion worth looking at how's our peer group doing. And so on the bottom of my sort of talking points page here, I put some benchmarks in there. Sure, these aren't your next door neighbors, but there's some other public entity groups that we support and service. And again, back to that PEPY, per employee per year number, as a very common sort of metric to benchmark against. Kewaunee County stacked up, really nicely against some of your other county brethren and a couple of cities that we work with. This isn't our entire book of business, but what I do like about this is that it's real time. If I was to go out and gain benchmarking from Manitowoc and Brown and Dorr and some other neighboring counties, that data would probably be 12, 18 months old. So it's not kind of as meaningful as this data, which we work on every day, and these figures are real time. So, we're in the bottom quartile of that handful of little groups there, and I think that again speaks to the work that the county's done to educate its employees on how to be good consumers of healthcare. The work that the employees have done to be good consumers of healthcare and try and remain, as healthy as possible, and to put the best vendor partners in place to help us manage those costs from both an administrative perspective and a stop-loss insurance perspective. So that's what I had to share with the group this morning. Again, absolutely open to any additional questions. If I can't answer them now, I will have them as a takeaway and get that information back to the group when I see you next.
Could you touch on how retiree play into the county is versus just people that are currently employed by the county?
Yeah, so the question of active employees versus those that have retired from the county. We don't have too many retirees left on the plan.
There aren't a lot. I can't come up with a number off the top of my head, but it's certainly less than 10.
And that sort of conversation around actives versus retirees is one that's probably been going on, not just here, but all public entity strongly for the last, decade or so. Retirees traditionally, as they age, get more expensive to insure, right? So from a risk management perspective, lots of public sector employers have tried to find a way to sort of gently migrate retirees off of the main employer's plan. Now, many retirees, had some promises made to them through some contractual obligations that they were going to continue to receive coverage maybe forever or until they become Medicare eligible. But lots of public entity have written into their contracts kind of moving forward and after Act 10 that retiree coverage, wouldn't continue after you retire, after you sort of cease your active employment at the county. And I believe that's what we have in place today. I don't think folks are retiring today with retiree coverage, or am I misspoken on that?
They can stay on their plan, but they pay the full premium.
Okay, so
So they
they're
have access to it. We didn't cut them off, but we don't provide a subsidy of any type for them.
It would just be Cobra, basically, right? That they would be offered when they leave.
Cobra has a time limit that I think they can stay on as long as they pay the premium, I believe, or until they're Medicare eligible. I forget
Right.
which it is.
And oftentimes when they see the full cost of the premium that the county's, been bearing the majority of on their behalf, it's a little bit of sticker shock, and they oftentimes search and seek out other alternative options, maybe through the individual marketplace, maybe through the exchanges. But you're right. Yeah, Cobra would have more of a finite sort of 18-month period. I believe the benefit in place today is you can stay on the county's plan, but you're going to pay 100% of the premiums, whereas for all of your working years, you paid about 10% of the premium. So it can be a little bit of a financial shock.
Can you share with us what you call the noise?
Sure.
You could do it by email or something. I just wanted to understand that. We're not making a decision today, right? This is just a presentation.
You don't have to make a decision today. In fact, I would recommend against, but I think today is for discussion, questions, getting information. Nothing would change with the plan until the fall renewal cycle as part of the annual budget.
No, the point I was trying to make was there is got to be a balance between how low of a cost we can deliver to employees and that they're getting parity and coverage, right?
Yes.
We don't want to drive to a plan that's super cheap for the county and employees, but most claims are denied. That's not what we're driving for. So understanding the noise would be helpful.
Yes.
Because that's really where the rub is, and we want to understand the friction. Now, in that same vein, it sounds like you are reluctant, or you just haven't taken the initiative to find out of those 76 families who have spouses that are insurable. And it seems like, from a fairness standpoint, to perhaps the 36 single people there that are also paying in and saying, it's our obligation. I think they would look to us and say, are there savings to be made there? I'm not advocating that we do anything with it, but it's interesting that we don't even know what the opportunity is.
Yeah. Okay, good. Thank you. Let me address both of those. Let's start with that last one on the 76 families. Yeah, I don't know if you're sensing reluctance. That's my fault. We can definitely explore that. Knowing who has a working spouse, though, is in question in general, right? It's not even, I could sit here and make the argument that it's not even the county's business necessarily to know whose spouse is gainfully employed and working full time, right? So the pre-analysis of that type of a program can sometimes end up in sort of hypotheticals because you don't know for certain. Now you could ask them, but I don't know that they necessarily have to be forthcoming with that information. Suffice to say, it's absolutely a space that, to the extent the information's available, my team along with the county can try to explore on your behalf and bring that back to the group. There's no reluctance in that exercise. Is that okay? If we bring that back to you? Information on out of the 76 families, how many have working spouses, to the extent we know that information? Mm-hmm.
Our insurance folks where I worked started asking people whether they smoked.
Ah, sure.
And, it was kind of an intrusion and, why do you need to know that? But I understand now.
Yep.
For people who are bringing that extra risk to the pool.
Yep.
That then they started being, they were paying a premium for their continued insurance,
Yep.
right?
Yes.
And it is a fairness. When I look at that, I say, well, that is fair. If you're going to take that extra risk, then why shouldn't you contribute more to the pool?
Sure.
And I think as we work for ways to try to find economies in this and still provide exactly the same coverage, I think that's a logical question,
Mhm.
if not from the employees, from us.
Sure. Sure. Yeah. And this, it's interesting you bring up smoking surcharges or a nicotine surcharge does oftentimes ride alongside this spousal surcharge, spousal carve out kind of concept. I'll save the philosophical piece there. Point made, point taken. We can get that data back to you to the extent it's available.
I mean, anybody in the private sector, I suspect, that has insurance, I get a letter every year that asks me, and I have to verify whether or not my spouse and children have other insurance available. Now, you said that's not necessarily something that, that's obligated or whatever. I don't know. That letter I get sure sounds pretty obligatory, and if I don't return it, they're moved off of the plan.
Yes, sir. If we were to institute the program, if we were to institute a spousal carve out or spousal surcharge or nicotine surcharge, then we do ask the question via sort of an affidavit letter like you're accustomed to receiving. At that point, yes, we're asking the questions. I think in the pre-analysis prior to offering that change to the benefit, I guess I'm questioning how forthcoming folks would necessarily be with that information. But if we were to say, yes, the county's now going to have a spousal surcharge or a spousal carve out, we would help you develop that letter that you receive at your home every year where we're asking people to attest that you do or do not smoke or use nicotine, be it smoking or vaping or whatever they are these days, or if your spouse does have access to other coverage. And not returning that form or being misguided in your answers on that form could lead to termination. Like we do create that document on behalf of folks for our handful of employers that do institute these programs. Yeah.
Do any other counties do this? Are we alone in not asking that question, or across the board do like government workers not get asked that question? For either other insured spouses or nicotine? Is that like not even approached here in the public sector?
I would say nicotine is a more common approach than the spousal surcharge or spousal carve out. Nicotine, I think we can all sit here and agree that the use of nicotine is detrimental to a health plan, sort of broadly speaking. Yes, there's statistics out there that say nicotine users versus non-nicotine users cost an average of $5,500 more a year in their medical claim experience. Are you with me on that? Stereotypical, but I think we generally can agree to that. Having a working spouse on the medical plan, particularly on a self-funded medical plan, a little harder to make a financial correlation. Insuring a spouse on the plan, whom uses very, very little to no healthcare doesn't necessarily cost the self-funded plan more money. Now, the alternative's true too. A very, very high healthcare utilizing person, be it working spouse or anybody, that's expensive for the medical plan, right? So if we knew that a program like this would obfuscate the county from insuring a large claimant, you with me? There's a bit more nuance on the spousal carve out side of things than there is on the sort of black and white nicotine utilization piece. Yes, sir.
I have an alternative then. Could you, rather than get it for the county, can you get it for the state? Just what if you can find data that says this is, on average, this is what those numbers are for both nicotine and for spouses? And then as a backup to the discussion before we have it in August, provide what the financial benefit, or whether you're describing it in vague terms, can you provide us that information more directly then before we have that? We have to make that decision.
I will try.
I mean, it sounds like you don't trust a survey that's sent out to our employees right now to be an accurate picture.
Yeah, I think the survey would. I think they'd answer the question appropriately. I think they'd say whether or not they do or don't have working spouses, and I think we'd find out that let's just say there's 20 working spouses. The question is like, now what?
Well, I think that's what we're asking. I'm asking you to do is say, now what?
Yeah.
Now, what does that do for us?
Yeah.
If we take this position, what is that really going to save us? And, you've already alluded to the fact that it may turn some people off to the insurance plan, and maybe one employee might say, screw it, I'm leaving, so I understand that. So can you, I think we had this discussion last year, and I think you had suggested that the economics of it aren't as clear cut as you're just going to save money for every spouse that's working.
That's a good memory. And I'm probably still in that position, but you're asking me to go a couple layers deeper, and I will try to do that and bring you back something more than this vague hypothetical.
That's all I'm looking for.
Yes, sir.
I was just going to add to that discussion. Absolutely support gathering some more information and bringing what's available and obtainable to the table. Makes perfect sense. I also kind of acknowledge the limitation of that in any given year, somebody might be, we're talking about relatively small numbers of people. So if it's 25 or 40 or whatever, how many people, if I have no history of using healthcare in the past 10 years, but then I get in a car accident, all that data is not any good, because it's just been, a dynamic change caused it to not represent what we thought it represented. So it's going to be, it's worth the exercise, but it needs to be understood that retrospective healthcare data on a small number of people is going to have a lot of variability and can't be heavily relied on.
Well, I think that's
Positive
another
or
reason,
negative?
another reason to look across the state as opposed to
Yep.
just this small group of people,
I
if that data was available.
agree. And then there's still, there's still the risk that no matter what decision is made, the data doesn't represent our individual experience because it's too small to, if you have a 95% chance of success, but you hit that 1 out of 20, you were 100% successful. And if you don't, you failed. And so there's always going to be variability in this data, but I just wanted to just kind of worth the exercise and worth looking at for sure. I just wanted to be on the front end of saying we need to understand the limitations of small numbers used as predictors.
But there has to be cost to adding people on the plan. I mean, you said that, well, it doesn't necessarily make a difference. Every person we put on the plan, there has to be cost.
Right. There are some fixed costs, right? So broadly speaking, in a self-funded plan, every dollar you put towards the self-funded plan, probably 80 cents on the dollar is oftentimes allocated for claims, medical and pharmacy claims. Maybe 20% of the dollar is towards fixed costs. Getting an entire employee and their family off of the plan, there are savings. My family of 5, if my spouse got excused from the plan, you still got 4 of us. And And so the savings on the fixed costs by excusing my spouse from the plan are minimal at best, is where I'm going with that. I maybe could have been clearer in my discussion around there's some savings. And certainly everything that was just referenced around, we could do the analysis. Yeah, but one claim plus or minus can throw things off. Well, that's always the case. So we still owe you the analysis. I can get you the analysis.
But isn't it true that if you get, I mean, this has been the argument about the forcing people to buy insurance. If you get a new, you're carrying someone who is paying a premium into the plan, but is in, say, between 20 and 30 years old, the chances that they're going to have a claim against the plan is probably very, very low, but they're still paying, or their family is still paying that premium. So in that case, you may get a savings from having more people on that plan too, right?
So yes, although in the county's instance, we'll use my family again. I'm a family, I'm paying family premium. If we excuse my spouse from the plan, I'm still paying family premium into the pie because I still take family coverage. That brings up another discussion around 2-tier versus 4-tier rates, employee plus spouse, employee child, full family, and single. You, like 99% of the public sector, have 2-tier rates, single and family. That's probably a discussion for another day, but I can tell you unequivocally, you are in the vast majority of normative data by having 2-tier rates, right? That's just what the public sector in Wisconsin has done forever. And there's no major benefit to 4-tier rates, at least for the county. If it costs $3 million to insure this population, it costs $3 million to insure this population. We're gonna get it some way, somehow, whether it's through 2-tier rates or 4-tier rates. It's just math. Yeah, it's fascinating. The other question on employee sort of noise, quickly. I have 4 groups with Centivo. 2 of them are public sector, 2 of them are private sector. And so we've got some experience with sort of the noisiness. I'll tell you that with these other groups, the noise is, it's not the entire population. If we've got 130 folks on the plan and probably 260 belly buttons, as we like to say, every sort of man, woman, and child, it's the vast minority of people that are having some noise, but those that are, it's lingering, it's mullingering, and it is causing those folks some stress and strain. It's around billing issues. It's around referrals to specialists. It's around Centivo maybe not being as familiar of a player when you go to your doctor's office and give them your Centivo card and they go, huh, what's this? Like, we don't take this. It's like, yeah, you do. It's a small amount of people. It's being addressed, but it's not widespread. Am I safe to, am I?
Yeah, that's accurate. And I think it's also, fair to share with the committee that we have been meeting with Centivo, Dan, myself, Peggy from my office, Ken from Dan's office, and a Centivo leader have been meeting weekly for anywhere between a half an hour and an hour to progress and clear these things up. I'm confident at this point that long-term, the issues can be settled. And if that changes, I'll certainly be, sharing that too. But I think that I don't think that there's an insolvable structural problem with the plan that can't be straightened out.
Okay. Anything else that I might be able to touch on or address?
I have one more question about the savings we've seen. I mean, we're sitting there seeing premiums going, right, even like last year, we recommended, we could have gone down or gone to 0 or something. Are we a true outlier amongst the counties in the state? Or are others seeing similar, like?
Yeah, no, I would say in the last span of a few years, you're an outlier in my book of business. I presume an outlier across the state. In fairness, I'd ask the question, maybe we were paying too much back when we were with Humana. Maybe we've just sort of
Yeah, but-
regress to the mean. Maybe we're back to where we should have been. Maybe we're also in what we would call a good claim cycle. When you're self-funded, over the long run, I typically believe that self-funding is a better way to financially manage a health plan, but there's going to be some rocky years in there, right? You're 130 lives. I mean, a couple people having a tough year and this thing changes dramatically. This isn't Walgreens, it's not Target or Walgreens. We don't have 250,000 people we're spreading this risk among. So back to answer your question directly, I think the last few years have been very good and very positive, and yeah, generally speaking, an anomaly across your peer group and quite frankly, all employers. I don't deliver 0 to 4% increases consistently to anybody ever. So it's been a good run. I'm not so naive to think that inflation, medical inflation in particular, isn't going to catch up to us, but we're going to continue to pull the levers and do everything we can to manage this cost as best as possible.
Thank you.
On the issue of annual costs too, the one, and Dan, correct me if or Paul as well, if I say anything inaccurate or that needs further explanation, but when I look at, the cost comparisons and see, well into the six figures of difference versus what the Humana trend was versus where we are now, the $500,000 or $600,000 a year difference, 85% of that difference would have been borne by the county were a change not made. So that's in my head real money, and I equate that back to services out to the public and the people to provide those services. And that's 4 or 5 positions we would have had to shed to be in the same financial perspective we are now, all of the things being equal. So I'm that savings and significant positive impact on the county budget for the change. I think I just wanted to pull that forward and mention that, make sure everybody was clear on that.
Anyone have anything else for Dan? When do you assume we're going to start the process for 26 renewal?
All you or me.
Anybody?
Yeah. Paul generally asks me for sort of a preliminary budget for what 26 looks like in summer, midsummer.
July, so I put the budget worksheets out in July, so I said preliminary late July, so I can have those out the first few days of August. But the decision making happens between August and budget adoption, so that's pretty wide timeframe yet.
Right. So I think that late summer timeframe, as far as what I've been requested, I mean, that data I will try and across the state's going to be a little tricky for me to probably find that data, but I'll look for everything I can on the spousal surcharge analysis piece. And I think that can be a couple weeks. I can probably have some written response back up to these folks. The actual like planning for 2026 is yes, that time frame between August and end of September.
Just out of curiosity, if Jeremy or Paul, are all our county employees on the plan, or are there some employees that are not on the plan?
There's absolutely employees who aren't on the plan. 120 lives across 150 employees means the insured lives count is everybody's family and spouses as well. So yeah, there's a number of county employees who don't take the insurance, and I could get that information. I don't have it handy right now.
It would just be, I'm just wondering if, because they're not taking our plan, they may be on their spouse's plan or.
Almost certainly.
Yeah.
Very common. And I think so that 120 number that you shared actually is only employees. So if you're telling me you have 150 employees and we have 120 of them enrolled in the plan, then about 30 don't take the plan. Pretty common. And yes, they almost certainly more than likely are taking coverage through a spouse. Maybe the spouse works at a public entity employer. I typically see though with my public entity clients, heavy enrollment in that employer's plan, because typically public employers have better, more cost-effective plans than private employers, just stereotypically.
So I run an employee list for costing and whatever else, but I also have insurance plans in there. So as of January 6th, anyway, until 60 days old, we have 149 employees on this list. 44 of them don't have health insurance through us. 73 have family, 32 have single.
Interesting.
And of the ones that do have coverage, 139 of 149 have family. Oops, sorry. It's P. Oh, that's full-time, part-time. So the 149 does include some part-timers. If you're a 50% part-timer, even if you did qualify for health insurance, it'd be unaffordable. So that's all of our regular employees, not necessarily the ones who are eligible for health insurance. But it's a good mix. It's a good overall summary of who has what.
Thank you. Anything else on health insurance today? Heard enough? Okay.
Mr. Chair, before we move on really
Yes.
quickly, so my understanding of, I just want to make sure I'm serving the committee, as you all expect. So my understanding is for now, we have some things to mull and to consider. Dan and I are going to work together, and Paul as well, to get some of the data that we requested about, statewide nicotine use costs and how those are implemented into healthcare plans and spousal, carve-out type, data. And then we're going to readdress this back in August, which would give us time to respond during the budget process. Does that sound like what people are expecting?
I think that pretty much covers it.
Okay, very good. Thank you.
Yeah. That we will have a lot of information when we start the initial discussion on this. Okay. Thank you, Dan. Appreciate it. Thanks, Jeremy and Paul, for getting this together. Okay, moving on to the agenda items. Next on the agenda is item 8, to approve a grant from Homeland Security for emergency management for a family assistance center that would affect the human services and public health. This is a grant that's coming in and we have to expense it off in the budget sheet. Tracy, do you have any comment on that, or is it pretty straightforward? And this is also approved by Doak's Committee on Law Enforcement, so. Is there any question on the grant? Otherwise, I'd entertain a motion to approve. Moved by Doak, second by Jeff to approve the Homeland Security Grant for emergency management. Any further discussion? If not, all in favor, signify by saying aye. Aye, opposed, hearing none, motion carried. Thank you. Thanks, Tracy. Okay, next on the item, on the agenda is the approval of the purchase of a Volvo loader for the Highway Department at the cost of approximately $301,000. This fund money is coming from the Highway Enterprise Fund, and it was approved by the Highway Committee for purchase. There was a lot of, information in the packet on it. And if there's any discussion, otherwise I'd entertain a motion to approve.
I just have one question. This was on the budget or planned to be purchased next year anyway, I understand, right?
That, I don't know, Marty. Jeff? Moved by Jeff, seconded by Steve to approve the purchase of the Volvo loader for $301,000 with the funds coming from the Highway Enterprise Fund. Any further discussion? If not, all in favor, say aye. Aye, opposed, hearing none. Motion carried. Thank you, Marty. Next on the agenda, there was a copy of the library services plan in the packet. Is that something we just need formal approval, or I was wondering why it was coming to the Finance Committee?
So that's a great question, Mr. Chair. one of the main contributing factors to it coming to finance committee is because it did last time.
Okay.
And so, and many of the things that end in county board resolutions end up passing through one oversight committee or another. So when I saw that, I said, okay, I guess finance makes sense because in theory, there could be changes to a library plan that might have a financial impact. That's not what we're looking at here. We simply reviewed and refreshed language. Full disclosure, the plan's quite late, was put on hold during COVID, and then nobody got back around to it until we started last fall. So this 5-year renewal cycle is, should cover us until about 2030, and many of us may only see one more renewal cycle after this one. So the plan language is in front of you. If you were looking to see major changes, then we might have some more work to do. But if you're thinking that the library system remaining relatively status quo is what you had in mind, and things are working reasonably well, then approving would be appropriate.
And the county certainly approves the library system.
The question I had was, you refer in one of the lines there about we're gonna fund it for some statute, or can you elaborate on that a little?
Yep, so I'm not an expert on it, but have a high level understanding. The county or the state has statutory language to basically charge the county of residents when their residents use library services from other counties. And so based on because everything that's checked out from the library, those materials are all logged. Those are then put into a system to charge back different counties. So it's financially to the Kewaunee County's benefit when our Kewaunee County consumers can get what they need from a library in the county versus if they happen to be in a neighboring county and pick up some library materials there, or they need to go there because the materials are only available there, we'll get a charge through a state calculation from those other counties.
I thought that also addressed how much we fund it for. Is our funding levels at the county level? Because there's a line in the budget for that. How is that calculated? I thought that was what that referenced.
Paul may know more about that than I do.
Yeah, that statute gives a formula, and we've been following that formula long before I've been here.
And so we
With the
pay
agreement.
the minimum amount that we're required to at that point, right?
Yeah,
Is that true?
Yeah.
Okay. And then on the policy, I didn't see anything about that issue that came up. It was very expensive for us for a few years, I think, that we were paying Brown County for a lot of users. There's nothing in that policy that addresses that as part of the mission to make sure that county residents are aware that when they use other counties, that it costs us, and it actually, I guess it's above and beyond what we're already funding the libraries for.
We've had various efforts to educate the county. I mean, I don't know what more we can do. We've spent hundreds of hours on this, I think almost literally. And the bottom line is, when people check out a book at Brown County, we get charged for that. If they request the book through our county library system, we don't. We've put this out there. We've had all kinds of campaigns to get awareness of it out there. Nonetheless, we get a pretty substantial bill every year from Brown County. Manitowoc, now it actually kind of evens out. We bill them, they bill us. Brown County is the one where we pay significantly. However, we have also looked at alternatives to this, and there is absolutely no way to do this any more economically. The only way that it could be improved for us would be if there would be a change in legislation in Madison. And well, take a look at the makeup of Madison and, I don't think I need to go in detail to explain to you that we're doing as well as we can with it. Let's put it that way.
And
I wasn't advocating
Oh.
for that we are ignorant of it. I just was surprised that we didn't have anything to address it in that plan or vision, that it's an ongoing cost to us. And you do have somewhat of a captive audience. You're talking about library users, so the library users in Brown County and in our county. You don't have anything in that plan. I just wonder if that was a gap.
Uh,
Because it's an ongoing
Yeah,
It's an ongoing cost that we should be addressing.
yep, no, and that's a good point. I'd be happy to work on it. It doesn't have to be necessarily everything that we will do will be in the plan necessarily. So I actually was taking notes to make sure that we're doing what we can with refreshing and keeping that message out there right now. So, yep, no, happy to have that knowledge and context, and I'll work on it, whether it appears in the plan or not.
And I know that the Algoma Library and the Kewaunee Library both are constantly reminding people, do as much business within the county as you can. It seems like people in the Denmark area in that school district do use the library a lot in Brown County.
Kikesville is also an area where they go to Brown County a lot. Bookmobile, they park right on the edge of the county. You know,
So-
and they play the cream truck music or whatever, but
So I think our local libraries are doing as much as they can to keep, keep people.
Very
No.
good. It's not in the plan, but it is something that I can happily work on and make sure that our needs are continue to be addressed there.
Any other discussion on the library service plan? If not, entertain a motion to approve. Moved by Doak. Second by Steve to approve the library services plan. All in favor, say aye. Aye, opposed, hearing none, motion carried. Thank you. Okay, on to item 11. We have two items that the committee has to approve, and then there's going to be review of the 24th year-end financial results. So the first one is carryovers from the 2004 budget that need to be put into the 2000 budget for projects that were not completed. Is that what it is, Paul?
Yeah, so page 23 has a memo, page 24 has a list of items that were budgeted for in 2024, not completed, except for one, the IT item. There's budget money in 2024, but that was approved to use that in 2025 for the licenses. So similar, but not exactly the same. Everything else was already budgeted for, but hadn't been completed within 24. So in order to finish those within budget in 2025, we have to bring those dollar amounts forward. This is probably a longer list than we sometimes have, but the process the last 5+ years has been routine, I'll call it. So this would need approval here. And then because it's changing the budget for 2025, it would also need board approval. Are there any questions on this one?
So as I understand it, Paul, these were already approved items and everything, and it's just simply just taking care of the billing on it.
Yes, sometimes it's scheduling, sometimes it's whatever, right? Like the jail doors, they were budgeted very early on in as part of 2024. The vendor hasn't gotten here. We still need the doors. So hopefully in 2025, we get the vendor here and finish the project.
I'm just trying to think of this a little differently. If we didn't approve this transfer, then this money would end up as surplus in the budget that we would, like the next section.
Well, it's already surplus. It's just
Exactly.
surplus we're gonna need, so it's not part of the next.
Right. Well, at least unspent funds that the county paid for, not grants. Grants we couldn't
Right.
redirect to our surplus, but.
Right.
And there's a fair number of these are unspent funds from last year. So.
Right.
It's either we approve them and approve that spending for the same purpose next year, or if we deny it, that would become more excess that we would deal with in the next section, right?
Yes, and there could be a problem there. I don't know specifically item by item, but if some of these things are already approved and signed up and we signed on the dotted line and we're gonna pay for them anyway, now if we don't approve the budget carried forward, then that department's gonna be over budget on that item.
Any further discussion? Otherwise, I'd entertain a motion to approve the transfers or the budget adjustments. Moved by Paul, second by Doak. Just a reminder that we've already approved the IT transfer that was done last month. So we don't have to worry about that, but the rest of them on the list we'll be approving. Any further discussion? Okay, all in favor, say aye.
Aye.
Aye, opposed, hearing none, motion carried. Okay, the next item is various transfers from the general fund. There is also a handout on that on page 25, 26, with some recommendations. One of them is the debt service fund, which is recommended at 255,000. That's basically in our financial policy to try to do 10% of excess surplus every year to the debt service fund. There's replenishing the auto damage fund, and the other two are future capital projects, which will all be transferred from the general fund surplus. Am I getting that right?
Like the items B and C are very closely, it's pretty much part of the same conversation. We had this surplus, so what are we going to do with it? I have the actual transfers and the results of that first because that needs approval. And then the rest of it, everything after page 25 is actually a summary of 2024 supporting the request in the memo.
That's what I was gonna ask you, if the documentation, all these pages are supports for what's being requested.
Yes, specifically for what's being requested, showing here's what the surplus is in the general fund and in summary, some of the other funds as well. And then also this being a good time to summarize how we ended up with 2024. Every entry I know of is in, everything's still subject to audit though. The auditors won't be here till mid-May. I don't know the exact date off the top of my head. I just want to note too that there were two invoices that snuck in late. I don't know the exact amount, but the combined total was under 5,000. So it really has no impact on this because I left a little wiggle room for that. So these numbers aren't exactly what we'll see in the unaudited final amounts, but the request is still exactly the same. Except, oh, take it back. There's one on the front page of general fund surplus, 10% of debt, 255,056. That was a correct amount. On the back, I didn't update it. It still has an older, slightly different number, but it's the 255,056. So I stated in previous months that I thought we would have a good year. That was shaping up that way. I wasn't sure it was going to be as good as last year, and actually probably came pretty darn close, like within 100,000. So I don't think I need to go through all the schedules, but I'll hit the highlights of why the general fund has such a large amount. So on the bottom of page 27, there's a list of largest contributors. So going down that list, the interest earnings in the treasurer's office between what we budgeted and what we actually received, 543,000. We have a number of vacant positions, particularly in the sheriff's department, where they can't seem to get up to the staffing. And also part of that conversation is with the new jail that was actually supposed to be almost opening by next year. We increased the staff levels. So there were 4 new budgeted positions that they haven't been filling. And then there was a plan for a new bigger building, 1 more additional position, plus some utility costs, some maintenance costs on that building that we stuck aside in the budget process. Well, obviously without the building in 24 or even 25 now, those funds that were set aside aren't going to be spent. That's the third item down, in new jail, additional costs. Sales tax came in $210,000 higher than budgeted. We got a surprise, well, surprise for me anyway. Tax increment from the city of Kewaunee, 104,000. The health department is still able to get COVID funding through 2024. There's a little bit in 25 and beyond, but those amounts are much, much smaller now. So they're able to spend time doing COVID grant related activities, which means that their levy related activities aren't as high. So there's a savings there of about $99,000. We got some insurance dividends. Sometimes we get those, sometimes we don't, depending on how our claims go. We did get both liability and workers' comp dividends this year for 72,000. We don't budget for those because we have, I won't say routinely, but fairly routinely gotten little or zero in those categories. And then Clerk of Courts was able to collect more in various court fees than was budgeted, and child support was able to get more in state revenue than what was budgeted. And that last one's $32,000, and there's a lot of small items left less than $32,000. So if you look at, if you want to know what department they're in, page 28 through 30 has every general fund department in super summary, revenue and expenditures, and it'll show you which departments contributed how much. I don't think we need to go that, because again, the biggest ones we have on that list of 10 or so items are the ones that actually make a huge difference. So since we had another $2.2 million surplus, actually it was a little higher, we took out the amount we just approved for the carryovers to next year. We don't want to count that twice. That will get us in trouble. We have an unrealized gain or loss. It's money we don't really see. We have to report it for financial purposes externally, but it's not money in hand, so we don't want to count that. So we have about 2.2 million, and the list that Chairman just read off, sorry, is where at least I'm proposing to send it. Future capital projects for our 74,000 of unspent contingency by policy. We have that in place. Debt service fund, 10%, the 255,056, again by policy from 4 years ago or so. Auto damage fund, that's newer this year. We have about $100,000 set aside in a fund balance for repairing our vehicles when they're in collision type accidents. And what that allows us to do is repair our vehicles, but not have to buy collision coverage year after year after year. It's worked out. It's been, I don't know when that came into play. That was in place before I started 10 years ago. But it has worked out. Our claims this year are a little bit higher. We had 1 or 2 more accidents, as well as the cost of repairing vehicles has gone up considerably. So in the budget process, we put an amount in there. We upped it this year. We'll probably have to up it again for a little bit next year. But putting 15,000 there keeps us around 100,000, which ensures that we can repair our vehicles when needed. And then almost everything else, 2,250,000 can go into our fund balance save for future capital projects. Last year we put about 1.5 million in there. We had about $500,000 that went to the solid waste fund last year to cover the differences between the costs there and what our long-term care fund will support. We don't need that this year, so everything in surplus we have can go into the future capital projects. Our fund balances unassigned are still right around 60%, would be around 60%, well above where we needed, very similar to last year. This then allows us to save for whatever those future large projects will be. We know we have a jail issue at hand and have for a while. We're currently looking at some highway improvements, and I know the Promo and Rec Department's looking at an improvement to Bremer Park Zoo. I don't know the exact status of that. I know a number came in. I know Dave wasn't happy with it. I'm sure he's going to be trying to chip away at that. That one's down the road. Oh, I don't know where that one is. But there are some projects coming up. This helps save it, set aside more now, which means we either borrow less or don't have to borrow at all or as much. We save on interest down the road. It also helps explain to the taxpayers, the bond buyers, the bond rating agencies, what we have this higher fund balance for. We know we have a need and we're saving for it, and that always reflects well on the county. So I would recommend those transfers for the 2024 surplus.
Oh.
Yes.
2 questions for you. The $74,000 we're transferring unused contingency. Do we have 400,000 in there and we ended up with more than that at the end of the year? That part I don't understand.
Okay. We have 100,000 in each annual budget. We spent, we didn't spend 74 of it. So that one would go to the fund balance. In the fund balance assigned, there's a $400,000 balance. So if we do nothing else, it increases that year after year. And
Oh,
years,
Okay, so let me see if I got that right. We put $100,000 in as a routine practice every year,
in our annual budget, yes.
but where's the $400,000 kept?
There's an assigned fund balance, so it's,
Oh, so we
it's
contribute
previous years
Okay.
unspent.
So we want to maintain a 400,000 in there,
Yes.
but we add 100,000 every year to kind of for unforeseen things that will probably happen that year.
Yes.
And so we only used 26,000. this
Yes.
year. I got it. Okay. The other question was, if we're going to approve this, are these numbers on this, I don't know what page it is, 74, 255, 196, are those the right numbers?
Page you got? There's a
The
page
one
number
with
on-
the actual, if we're going to approve something,
Oh, the one for debt service fund needs to be 255,056.
I make a motion to approve these transfers. The numbers that Paul just said. Okay.
We have a motion by Doak. Is there a second by Jeff to approve the fund transfers as presented? Any further discussion?
Yes, on that COVID funding, is there a possibility that's gonna be a callback from the federal government on that at all?
Just had a conversation with Cindy yesterday. There's discussion going on there. It's all up in the air. So her question was, well, what do I spend? I'm like, well, if it's stuff we know we're gonna spend anyway, like time and wages and salaries, we're safe spending it. I wouldn't buy anything new and big that we're not gonna buy if we didn't have the COVID funding, because we don't know 100% that we're gonna get reimbursed for that. I would say 30, 60 days from now, I think we'd have a clearer picture. So we'll do the safe expenses now. And if there are any bigger items, we'd have to wait and make sure we're gonna get reimbursed for those before we actually buy it.
Any other questions or discussion? If not, all in favor of the motion, say aye.
Aye.
Aye, opposed, hearing none, motion carried. Okay, on the item C under that same agenda item, we've pretty much covered that.
Unless there are any other questions about how 2024 turned out, obviously unaudited at this point. And the audited statements usually come out in August.
Just briefly on this item, I would just ensure that bringing again for awareness, looking through the sources of that surplus. Many of them are unsustainable, can't be counted on. So yes, we're great to have a positive surplus that allows us to save for the future and offset some future borrowing costs. But the budget is in line for anticipated expenses, and we're not starting 2025 expecting a $2.5 million surplus again. So we'll hope for another good year and some windfalls, but our current year budget is pretty good shape, and we'll be very grateful if it turns out anything like 2024 did.
We leave it in your hands to make sure that happens. Thank you, guys. Okay, moving on, the vendor payments were available for review. I don't know if anybody has any questions on the vendor payments. Is the supplemental payroll floating around here somewhere? Okay, anyway, that's out there. So on the supplemental payroll, I'd entertain a motion to approve that as presented, which is right up here, I guess. Moved by Doak, second by Paul to approve the supplemental payroll as presented. All in favor? Aye, opposed, hearing none, motion carried. Any other matters to come before the committee? Jeremy, Paul, Mr. Chairman? Anyone else on the committee? Okay. Our next meeting will be Friday, May 9th, 8 o'clock. And having said that, I would entertain a motion to adjourn. Moved by Jeff, seconded by Doak to adjourn. All in favor? Aye, opposed, hearing none, motion carried. We are adjourned at 9:24. Thank you, everyone. Frozen my ass off my first